Hey there everyone! Thank you for taking a look at this video. I wanted to provide you with some tips to keep your hips nice and mobile so that you can keep moving, keep walking, keep running, whatever it is you are doing to stay active and fit. This is going to be a couple quick exercises that I commonly help people see or just give to people that will help them with their hip mobility. This is if you're having hip pain, could help with back pain. But if you're having any sort of pain, I would highly recommend seeing someone like myself, Movement First Physical Therapy, to find out what the cause of that pain is so that you're not just trying to address the symptoms. Again, hip pain could be coming from your back, could be coming from weak feet. But what today is all about is going to be addressing those symptoms, trying to get some more mobility in your hips, and try and get a little bit of strength as well. So I wanted to start with a couple mobility exercises, go through some short stretches. So mobility and stretching is awesome. The thing that is important to understand is that mobility and tension often comes from weakness or lack of control in areas. So we want to make sure that we always reinforce with strength. We always reinforce with making sure that you can control a motion that you gain. So if we're stretching into a motion, we also want to strengthen that motion. So we're going to go over a couple different exercises and try and keep it short so that you can kind of digest this and take it into your exercise program or use it as a warm-up. But first, what we're going to do is we're going to do some soft tissue massage. And so I have a ball. So first thing we can do is do a psoas release. And so what we're going to do is put that ball right on the ground, and we're going to lay right on the front of your hip, right inside of that bony point of your pelvis. And you're going to feel some tenderness there for sure. That's your hip flexor muscle, your psoas. Notice I'm kind of got my knee up and I'm kind of rocking side to side. You can also kind of rock your pelvis side to side. You're going to feel a little bit more tension when you get to a spot that's a little more aggressive. And then you just kind of hold this for about a minute. And hopefully that tenderness subsides a little bit. And what that tells me is that muscle that is kind of tight and bunched up, maybe triggered in a trigger point, is just kind of released and calmed down. Cool. From here, what we can do is we can use the ball or a foam roller. I'll use the ball here, and we're gonna do on your glute. What we're gonna do is we're gonna kind of just stick it right kind of where your back pocket would be. And you're gonna kind of, your glute goes from where your pelvis is here to where that bony part on your hip is here. And so any area in that area is going to be good to address some of those glute tightnesses. Now your glute can cause pain down the side of your leg, it could cause buttock pain, and if it's weak, it can cause knee pain. So making sure that this is nice and mobile and strong is really important for all those things and good health. So I'm just sitting here. You can kind of roll around, find a spot, and then you can kind of you can either move your leg or you can let your leg rest off to the side, and you're going to feel that tension is kind of tender again. And as you hold it there, it should kind of calm down. All right, great. Last, what we're going to do is we're going to take that ball and we're going to go a little deeper down into the buttock area, down to that meaty area, nice lower buttock. We're going to put that ball there. We're going to cross your leg, and we're going to kind of sit on up. This is probably maybe better done on a foam roller because it's less pinpoint, maybe less kind of tender. So let's show you that. I can do it on a ball just because I'm used to it, but taking a foam roller, crossing that leg, and then rolling over that piriformis. I like to cross the leg because that gets that piriformis a little bit more exposed for the soft tissue release. And then rolling, and you can rock side to side on it, and just let that again for a minute or so and let that tension reduce. Great. All right, from here, let's talk about stretching. There's a couple stretches that I really like. We're gonna go over 3 right now. So first, we're gonna talk about a hip flexor stretch. And what you're gonna do is you're gonna kind of be in this half kneeling position. You're gonna tuck your tails, if you're tucking it between your legs, pulling your pelvis up in the front, and you're gonna squeeze your butt forward. What you should feel is a nice stretch in the front of your hip and then all the way down your thigh if those thigh muscles are tight. So again, it's important to contract and pull your pelvis up here, so you're kind of tilting, and then go forward. If you're kind of leaving your body into that extension, you're not going to get as much stretch in the hip. You're going to get more motion through your back, which could cause discomfort. So you're going to have that tension right in the thigh. Again, holding this for about a minute. That long hold is going to get your body to kind of condition itself to tolerate that motion a little bit better. Next, let's talk about a hip adductor stretch. So being able to kick your leg out to the side like so. And so what you want to do, you want to kind of go on one knee, one leg out to the side, and then you're going to kind of sit or kind of hinge at your hip, sticking your butt back towards your heel, and then come up. You're going to feel this all on the inner thigh, as well as maybe a little bit in your groin. This shouldn't be uncomfortable. If any of these are painful, you know, it's good to talk to me, and at the end I'll tell you a couple ways that you can kind of get in touch with me to if you're trying to get out of discomfort and keep moving. So this one, as you notice, I'm not really holding, I'm actually moving through. This is kind of more of a movement stretch, a motion tolerance. And so again, I'm feeling that on the inner thigh. I'll do about 15 reps, do it twice at least, and then I would repeat on the opposite side. Usually you want to do these things on both sides. If you're gonna want to focus on one side, maybe just do an extra on that side. You always want to try and keep it symmetrical. All right, and then the next one is gonna be a pigeon stretch. I'm gonna show you from the front first. You're gonna bring one leg forward. You're gonna turn that leg in. You're going to lean towards that leg and then sit back, and you're gonna feel a nice stretch in your buttock. What you don't want is your back to be all sorts of twisted. All of the motion should come from that hip. So again, rotating at the hip, shifting my hip to the side, and then sitting my butt back. So let's see that from the side. All right, so again, I'm twisting my leg in, I'm shifting my body weight towards that side, and then sitting it back, kind of sitting into my heel. And so a lot of people kind of want to go all the way, but all you need is just that little bit, shift. And if you're not feeling it, kind of make sure your back is nice and straight. I mean, you can even play around with keeping a ball on your back, because if that ball rolls over, that means that you're not really stretching your hip. So again, trying to hold that for about a minute. If you're doing a hold, you want to do for a minute. If you're doing repetitions, you want to kind of do 30 reps. All right, great. So now that we have that mobility, we want to make sure that we can control it. So one of my favorite exercises to do for controlling hip extension, which is some of what we were working with the hip flexor release and the stretch, is gaining hip extension. So your ability of your leg to go backwards. That's important for walking, that's important for running, that's important for most everything. So one of my favorite exercises to reinforce that is a bridge. So what we're going to do is we're going to go on your back. And I ask people to do a bridge in a specific way. You want your feet close to your hips, and I want you to think about where your hip joint is right here, and I want you to focus on moving there, keeping your whole torso as neutral and still as possible. So what you're doing is you're going to drive from your upper hips, your upper buttock. So again, my buttock goes all the way up to here, so I'm going to be pushing from all the way up here, the top of my pant line. Keeping my back straight, I'm going to drive my hip joints forward, okay? So I'm driving my hip joints forward, and then on the way down, I'm bending at those hip joints to let my butt down, and then driving up, holding. You can hold for 10, 15, 20, 30 seconds, a minute. If you can hold for a minute, it's awesome. Maybe it's time to start a single leg, so kind of lifting and then lifting the opposite leg up like this. And again, you should feel this. Up here, as well as a little bit in your hamstrings. If you're cramping in your hamstrings, you might not be using those glutes well. Again, something to, if you can't kind of correct with some things, definitely something to talk to someone about. All right, so that's hip extension, using that hip extension when you gain it. Next, we want to be able to use your hip abduction. So out to the side. So one great stretch again is strengthening those glutes. Great exercise to strengthen those glutes is lying on your side and bending this bottom knee, keeping this back knee along your foot, and then trying to keep that back foot towards the wall as you lift up. When you lift up, you're gonna feel like this muscle might wanna cramp because you're not quite used to, if you bring that leg forward, you're using more of the front muscles, and that's why we feel like we have tight hips. But if you bring it up and kind of bias backwards, what you're gonna experience is these bigger muscles that aren't really used to being used cramp up. And this is important for walking to keep your pelvis level. It's important for running to keep your pelvis level. Important for going up and down stairs so that your hips don't hurt doing that. So all those are really good for being able to control that stability of the pelvis, which ultimately is kind of bringing your leg out. All right, so last I want to express gratitude for Monica and everybody at TAPS for putting on the walkathon, and let you guys know that you're all doing awesome. Doing awesome on Strava, being able to get out and exercise, keep moving throughout any of the challenges at the beginning of this year. And so congratulations. And I wanted to let you guys know that if you are having discomfort, if you are having pain, please just reach out to me, ask me some questions. I'm happy to answer any questions I can, give you any tips I can, give you any recommendations I can. We can hop on a video call. You can go on callwithdrbill.com, and that can help you sign up for a video call with me. And just having a conversation, trying to figure out what's going on and what the best way to address the root cause rather than continuing to try and address the symptoms. If we continue to address those symptoms, then we're kind of a slave to them rather than becoming free from that pain and moving, feeling like the best version of yourself. So again, callwithdrbill.com is a great way to schedule a video call with me. You can message me at brenkasdpt@movefirstpt.com, or you can find me on Facebook at Bill Renkas, or on Instagram, Movement First PT. So at Movement First PT. Feel free to follow me, friend me. Happy to share everything I have with you. And so I hope this helps at least one person, and I hope you guys all get something out of it, and it helps you feel better about your hips and keep moving. So thank you so much. I can't wait to talk to some of you hopefully, and keep working on moving.